Stress and adult ADHD. ADHD adults experience more stress than the average person because of their symptoms. For example, they may feel stress when overwhelmed by too much to do or clutter. ADHD adults may feel stressed by feelings of dread. This occurs when they need to perform on the spot, job interview, or under time pressure, taking a high-stakes test. It is important to discriminate between internal and external, or environmental, stress. Internal stress relates to your emotions and thoughts. In such situations, you trigger stress with negative thoughts, fears, and what-ifs. ADHD adults may suffer from internal stress based on unsuccessful school/work performances or unfulfilling interpersonal interactions. External stress may occur from the setting. For example, people making unrealistic requests, trains or buses that are late, or slow processing when needing to do highly detailed work. ADHD adults ask, is all stress bad? During regular work/life situations, some stress can be helpful. For example, good stress results in feeling pumped up or ready for a challenge such as a sporting event, interview, or a happy occasion. But when stress is extreme and long-term, it is harmful to your physical and emotional well-being. For example, for Harris, stress is negative. He is overloaded and can't focus and perform effectively. He has negative thoughts and physical symptoms of stress such as a headache or butterflies. His unmanaged stress aggravates his common symptoms of ADHD, such as sleep problems. Can stress cause ADHD? However, several factors make ADHD adults more vulnerable to stress. These include poor sleep, daytime fatigue, too much caffeine, and overstimulation. Also, persons with ADHD may suffer from overstimulation from electronic or digital devices such as computers, cell phones, or television. All these can increase vulnerability to stress. There is a dynamic and constant interaction between the symptoms of ADHD and stress. For example, you have trouble focusing or remembering and your stress level rises. You're irritated by a coworker, your stress level rises, then you are more distracted and forgetful than ever. When symptoms are severe, ADHD may cause a perpetual state of stress and forgetfulness. Can you have ADHD and anxiety? Some ADHD adults experience continued high levels of stress. In some cases, they are diagnosed with clinical anxiety, as determined by a physician or psychologist. If anxiety is triggered by ADHD symptoms, then treatment of the ADHD symptoms is advised. That can include cognitive behavior therapy or medication to reduce anxiety. In other cases, adults have anxiety independent of their ADHD. Again, therapy and/or medication may be prescribed. Some stimulant-drug treatments for ADHD may worsen anxiety symptoms. Monitoring anxiety symptoms and possible side effects of medication is advised.